Let's get wild tonight. Turn the fuck up, we going out tonight. I've been waiting all my life. Every time I go out, I think I found my wife. I can't help but turn down the lights.
My name's John Cook, and I'm a medical doctor. And I want to start this pitch with the idea that I've got some good news and I've got some bad news. And I'm going to start with the bad news. And the bad news is that I want to draw your attention to a horrific problem that we seem not to see. 44,000 people die from cardiovascular disease, that's heart attack, stroke and some other events, kidney disease and so on. 44,000 people. That's the population of Coffs Harbour dying in 1 year. That's a car accident, a fatal car accident every 10 minutes. It is a monumental problem. It seems unbelievable. So let's swing the attention around to you. Let's think about what the statistics tell us about this room of 250 people. 30% of you in this room will have a diagnosable cardiovascular disease. Think about it. And you may or may not know. In fact, a lot of you will not know that because either you haven't been tested to see whether you have it, or you will have had a screening test done. A screening test called cardiovascular risk. I think it's Australian cardiovascular risk. That's a blunt instrument. It's so blunt, it's no better than a flip of the coin. Which one of you is going to be a Coffs Harbour victim? Australia spends truckloads of money on cardiovascular disease. 20 billion, maybe a whole lot more if the reality of the economic situation is realised. Okay, let's move to the good news. This is unnecessary. It's predictable and it's preventable. The current screening testing is not fit for purpose. We need a better screening tool. Guess what? CardiAction is that better screening tool. And why is it better? Is because it can be used anywhere, anytime, on anybody. The 3A is essential for screening, for mass screening. And what's more, it doesn't require a blood test. No blood tests required. Why is it so much more effective? Why is it 80% catch rate for people with cardiovascular risk? It is because we attend to the root cause, inflammation. So, we can say we have tested First Nation peoples. Yes, we have tested in pharmacies. Yes, we have tested in medical practices. Yes, we have tested someone on the street who got caught for a test. Yes, we have tested in gymnasiums. And what's the outcome of that? Well, the outcome of that is we are a large insurer, health insurer in New Zealand's preferred cardiovascular risk manager. We have 30 stores distributing cardiovascular risk management with the opportunity and progressing to 350 pharmacies. We're a small team, and dare I say, something like 170 years experience in engineering, in IT, in AI, in medicine, you name it, we've been through it all. So why am I up here pitching? Why am I pitching to you? And I'm pitching to you because we are wanting to partner with someone who has, or some people who have the same passionate vision about trying to solve one of the hardest problems in the world, certainly one of the largest health problems in the world. We want somebody with a social conscience to put their shoulder to the wheel to help us through this. And when it comes a time to take our scalable, groundbreaking, world-first discovery to the world, they will be there to help us up. So with CardiAction, let's keep those hearts pumping. Thank you.
Well done, John. That was great. I must say too, I've definitely enjoyed working with you and the team over the last few months. It's been amazing to see the refinement in your product and where we're at today compared to the first conversation that we had in our 2-minute speed dating. I think it'd be really good to understand a little bit more detail in terms of how you generate revenue across the 3 different commercial verticals that you've identified throughout the pitch.
Sure, Nick, and thank you for your mentoring. So look, we're a SaaS, we're a B2B, and with an IRR of 15%, we're not complicated. It is as simple as that. Thank you.
Thanks, John.
Thank you very much.